It's 8 o'clock. I promised to do this live from 8 o'clock, and it's meant to be a very brief one. I would like to make a start because 15-20 minutes from now, we should be done with this because it's going to be short, like I said. So, my name is Dr. Chain Akano. Today, I shall be talking about posting. Generally going to be talking about emergency contraception. So may I start by explaining what emergency contraception? First and foremost, contraception is a means of preventing pregnancy. That's what contraception means, how to prevent pregnancy. Emergency means how to prevent pregnancy in an emergency situation. So, what are the emergency situations that you need to prevent pregnancy? It means that the person is not already on contraceptive or hasn't used any means of prevention, and they had unprotected sexual intercourse, or maybe they used condom and the condom burst, or maybe they adopted the means of withdrawal, coitus interruptus, and for some reason it didn't go so well. Or maybe the woman is already on contraceptive and probably forgot to take the contraceptive. Or maybe the woman is on contraceptive already and then has been taking medications that reduce the potency of the contraceptive they are using. Therefore, they need another contraceptive means to prevent pregnancy. So that prevention of pregnancy in an emergency basis is what we call emergency contraception. So basically, it's how to prevent pregnancy. These medications do not lead to termination of pregnancy. You cannot take them to terminate your pregnancy. They're not for abortion. You can use them to prevent pregnancy. So basically, there are two ways you can prevent pregnancy in an emergency situation. Even though I'm going to be talking more on the tablets, but let me just highlight the most effective means of doing that, which is known as is by introducing what we call coil. Intrauterine device is called coil. Example is what we call copper T, that can be inserted into the womb of the woman within 5 days of having unprotected sexual intercourse. Within 5 days. That's very effective. It's nearly 100% effective, but that would mean that you have to get someone who knows how to insert the copper T under antibiotic cover to put that into your womb, and then that would prevent pregnancy. And it can be done anytime within the first 5 days, anytime, and the pregnancy will be prevented. But obviously, that doesn't sound, that's a little bit more cumbersome. And, so people resort to the tablet form of contraception, which in layman terms is called morning after pill. Even though it's called morning after pill, it does not necessarily mean you have to take it in the morning after the intercourse. So the morning after pill is where posting falls into. And we have two different types of morning after pills that are available. There's one that, instead of calling the pharmacological name to confuse you, there's the other one that is called, one of the examples is Ella 1. Ella 1 is more effective than Postinor. Ellaone can be taken within 5 days of the intercourse, up to 120 hours, and is quite effective. But with all these oral contraceptive, all these emergency contraceptive, the sooner you took them or the sooner you take them, the better for you. Usually, they are more effective within the first 12 to 24 hours after the unprotected sex. So, but Postinor, which is a form of medication known as levonorgestrel, is also sold as Levonel, but in Nigeria, I think is basically sold as Postinor. Sometimes it comes in 1 tablet, sometimes it comes in 2 tablets. So it's usually taken within 72 hours, within 3 days of sexual intercourse, within 3 days. But like I said before, the earlier you took it, the better for you. It is more effective within 12 to 24 hours after intercourse. You take them with water or take them, orally, and it prevents pregnancy. It is quite effective. The efficacy is better if you took it just immediately or within 24 hours of sexual intercourse. It is effective up to 84 to 99% effective. So it's quite an effective means of preventing pregnancy. So just to make you aware, if you took your Postinor and for any reason you vomited within 2 to 3 hours after taking it, then just be aware that it wouldn't work. So you would have to take it again, take another tablet. But if you vomited after 3 hours, then it's fine. It would have been digested and absorbed, and it would do its job. How does this medication work? The Postinor, how does it work? It is important for you to understand this. It works by delaying or preventing ovulation. You already know what is ovulation. Ovulation is the process whereby your ovaries release eggs, or egg, ovum or ova. So that process, every normal woman ovulates once a month within their menstrual cycle, which is usually 10 to 14 days, depending on the woman's cycle. So Postinor does delay or prevent ovulation. That is how it prevents pregnancy. Why I'm saying this is that if you had sex during your ovulation period and you have already ovulated before you had sex, then the Levonel or Postinor may not work, because it does not stop fertilization. Fertilization is, like you probably know, is the mating of the egg and the sperm. Levonel, Postinor that you take will not prevent fertilization. It will prevent or delay you from ovulating. But if you have already ovulated at the time you had the sex, then chances are that you're going to be pregnant, even if you took the Postinor. So the timing is important. Okay? So, like I said, it does not prevent, it does not cause abortion. You can't use it to terminate a pregnancy. It does not prevent fertilization, but it prevents or delays ovulation. So if you know your cycle very well, you need to take them only before your ovulation, or way after you have ovulated and your eggs have all dried up. But if you take them just after you've ovulated and you had sexual intercourse, then chances are that you're going to be pregnant even when you took them. I don't know whether I'm making sense, right? The next question is, how often should one take Postinor? To be clear, Postinor is not your usual way of contraception. It should only be taken in an emergency. On a good day, the advice is that you should take your Postinor only once in the menstrual cycle. The menstrual cycle is from the day you had your period to when the next one started. From beginning of your cycle, 28-day cycle, 30-day cycle. So within that number of days in your cycle, you are advised to take it just once, but you can also take it twice. But just be aware that it shouldn't be your regular means of contraception. It shouldn't be if you have unprotected sex today, you take one, you have unprotected sex tomorrow, you take two, you have unprotected sex next tomorrow, you take three. No. So you should just aim to take one or two within your menstrual cycle, because the more you take it, the more likely, there's a likelihood that it can cause menstrual irregularities for you, or your period may change, or your period may delay, or menstrual irregularities may occur. So it shouldn't be like Panadol you take each time you have headache. So if you know that you need to prevent pregnancy on a regular basis, then Postinor is not the medication for you, it's not the drug for you. Do you understand? You should rather take, go on other forms of contraception, be it condom or pills or coils or Mirena coils or, whatever. Postinor is an emergency medication. Some people want to ask sometimes, does it affect your fertility? Some people are scared that if they take Postinor, it may affect their fertility. No. The good news is that Postinor or Levonorel would not affect your fertility, because they don't last long in your system. It does its job, prevents the ovulation, delays the ovulation. After a couple of days, it's all gone out of your system. So your fertility would not be affected if you take Postinor. Then, what else do I need to... Yeah, does it have effect if, sometimes you may not know that you're pregnant and you take it? Are you scared that it may affect your baby or it may cause abortion for you? No. Postinor would not normally affect your pregnancy if you mistakenly took it, not knowing that you're already pregnant. It will not make you to lose your baby, and it will not affect the baby or the pregnancy in any manner or form. It's relatively safe. More than thousands and thousands of people take it without any problem. But obviously, I will also mention one or two conditions that you shouldn't be taking it. Another thing we'll talk about in relation to this medication is, like I said, it's usually safe, very, very safe. But if you do have liver disease or a condition called porphyria, then you may need to avoid taking it, because it's not advisable for you to take it if you suffer from this kind of problems. All right? And obviously, like every medication, it could cause side effects. It could cause side effects. One or two people may have very severe side effects, very rarely, but it does happen. What we call, they may develop very itchy rashes or wheals, or, maybe their lips or their throats may even get swollen and have what we call angioedema, or may even progress to what we call anaphylaxis that can kill. But this is very, very rare. It's very rare. But the common side effects would be maybe like breast tenderness, menstrual irregularities, tiredness, spotting, like bleeding from your down below, things like that. Dizziness can also occur. These are some of the side effects, but usually a fairly safe medication to take, as long as you take it within advised modality. You'll be fine. You'll be fine. But if you have a need to be on contraception, please, it's not Postinor. It is not Levonorel. The advantage of the other one, the coil that I told you about before, is that if you had it inserted, it would prevent that pregnancy and can serve as a contraceptive for you. So it will prevent pregnancy that index one, that one that you wanted to prevent, and then it will prevent subsequent pregnancies. You don't need to do anything else. You can stay there for years as your contraceptive, unlike the tablets that you just take and then after one day or something, it's no longer effective. I don't know whether am I making any sense at all, guys? So like I said, I want to make this brief, and this is all I want to talk about Postinor. So in a nutshell, it is not a contraceptive you have to take every day. You have to take it only as an emergency. Try and avoid taking it more than twice in your cycle so that it doesn't disrupt your cycle or your menstrual pattern. Just aim to take it like once or twice. And if you need to prevent pregnancy on an ongoing basis, then you should go to the family planning clinic and consider options. We have tablets, combined oral contraceptive pill. You have the progesterone only pill. You have the intrauterine device. You have the intrauterine coils. You have that. You have the no plant implant. You have, you have different other ones you can use. You can also, if the man is diligent, you can also use condom. We have male and female condoms. So there are different ways of preventing pregnancies on an ongoing basis. But Postinor is not one of them. All right? Okay, so I'll see whether there are any questions to answer briefly, and then I don't want to see people crying about data. My data is finished. That's why I'm actually looks like some people are giving us stars today, or am I actually seeing them double myself? So let me see. No. Let me see whether there are any questions to answer so that we can all. I'll try as much as possible to do this more often and take it in short sessions so that people don't, exhaust their data. Someone asked, what is the topic? That's Priscilla Chibik. I said the topic is, emergency contraception, and our main focus today is the tablet, Postinor or Levonorgestrel, which is levonorgestrel, that people take to prevent pregnancy. That is also known as morning after pill. It doesn't mean that you have to take it only in the morning. It's my first time of hearing of Ella1. It couldn't be, because I've mentioned it severally. If you've been following, Ella1 is more potent than Postinor. It's more potent, and you can take it a lot longer after the date. You can take it up to 120 hours, 5 days after the intercourse, while Postinor is recommended to be taken maximum of 72 hours. Though the sooner you took it, the better for you, So Linda, how are you? Yeah, Uche. Favor, how are you? How are you? Long time, oh. Chinwe. Good evening to Chima. How far? You okay? Marco, I could cite you. How do I share this live stream? Kingsley Chimex, you haven't mixed anything. I'm going to share it. I'm going to post it on the walls, and then you can listen to it later. Okay? So no questions. I don't have data. Yeah, that's always the talk. But at least yeah, Gracie, how are you? Yeah, Grace, I will give you a call much later. Happy birthday in arrears. I didn't have the chance to speak to you on your birthday, but I'll give you a call. Godwin's Bechi, how are you, my friend? Omolola Baoni. Wow, Choma, Honorable One, long time. Where have you been? Wow. Messi, Cardinal, good evening, my dear. Uchenna Nixon, Brigwo, Mange, you alright? Yeah, Priscilla, good evening. Okay, so is family planning strictly for married people? No. How can family planning be strictly for married people? It's not only married people that get pregnant. It's not only married people that have sex. Family planning is for anybody that has sex, anybody that has the potential to get pregnant. That's what family planning is for. Family planning is contraception, how to prevent pregnancy. It has nothing to do with marriage. Absolutely nothing to do with marriage. It's the means of preventing pregnancy. That's why that is family planning, preventing pregnancy. Even though it's called family planning, it doesn't mean that you have to be married. A condom is a family planning method. Is it only married people that use condom? Is it only married people that use pills? Is it only married people that use that have coils inserted, use spermicides? Even some men, especially Yoruba people, have their tube cut off. What we call vasectomy. Even when they're not married, maybe they have 1 or 2 children from their girlfriends and they don't want to have kids again, and they yank off their their tube, and then so it has nothing to do with marriage at all. Actually, in the Western world where we live, a lot of them don't get married anymore. They just cohabit and have children and live like that forever. It's very preponderant here, So some people are giving us stars. It looks like that's interesting. The first time, So if you can give stars, give. It will be nice to see stars coming, So, all right. Let me see. Lydia. Where is this? Where are those questions? They all disappeared. So that's how I'm going to be doing it from time. Whenever I have time, I'll just take short sessions. You know what I mean? Short sessions like this, so that I don't overload you with facts or with stuff, and then you get confused. But at least I believe that anybody that followed this live session would understand when to go get Postinor and when not to get Postinor, how often to use it, how much to take, and the timing of the cycle. Maybe in one of the sessions I may discuss how to know that you're ovulating, when is your ovulation time, ovulation period, so that you don't get it mixed up. Maybe after ovulating and your eggs are there and sperm has gone to meet it, and a baby has already been formed, and then you start taking Postinor. It will not work. It will not work. That's one of the reasons why it fails. Okay? All right? So, I think, I don't know why the questions all disappeared. Swipe left to review comments. Swipe left. Okay. Oh my God. The Chairface, my man. It's good to see you. We do this again and again. I remember when I used to do it often. And, but I became too busy. But for now, Mondays, some Tuesdays, and some Thursdays like this, I shall be able to do something in the evening like this. But weekend, no, just brief. Okay, guys. All right. Banky. Banky, how are you? Doctor, I hope you agree with my positions. Sugar, yeah, your first time of being on live with me. There's always a first time. We're gonna do it again and again, okay? All right. I shall call it a day. Take care, guys, and thank you for joining in.